The reason I became an ophthalmologist was because I found that this is a profession where you can really change the life of a patient quickly. I find the profession, and that's what I thought all along when I started, very rewarding. Then you can quite easily prevent blindness, help in improving visual acuity, and changing the lives of the patients. The ARVO meeting is still one of the most exciting meetings that we have in ophthalmology. I think the most important thing about the ARVO is the fact that it brings together researchers, PhDs, with clinical investigators. And the debates that come around the posters and in the relatively long talks at the meeting and a lot of discussion bring along a lot of interaction and interesting ideas that are very important. I am going to the ARVO already for 20 years every year, and every year that I come, I learn a lot and I enjoy a lot. One of the things that was important in this meeting was the DRCR-NET symposium that showed a little more about our management of diabetic macular edema, a topic that is very interesting to all of us. There weren't any really new things that we didn't know before. However, it emphasized the cost effectiveness of anti-VEGF therapy on diabetic macular edema and various treatment regimens. And the very long discussion and the debates that came around it were very interesting, and I think everyone can learn a lot from them. I think ophthalmology is a great profession because every day we have new things, new technologies, new drugs. And when I went into ophthalmology, there was actually no treatment for age-related macular degeneration, and all patients got blind. And nowadays, thanks to the anti-VEGF drugs, there is almost no blindness from age-related macular degeneration. I think the future holds promise for the treatment of non-neovascular macular degeneration, namely geographic atrophy, which is still an unmet need, and also holds promise in preventing the need for monthly treatment of the patients by providing long-term agents for our patients. I think ophthalmology is very, very exciting nowadays. We have many things coming up in ophthalmology now. We are talking about the development of long-term agents for macular degeneration, which are very, very important. We are talking about the use of big data for diagnosis of the disease, like having a machine that diagnoses all the diseases and diagnoses the progression and predicts which patient will respond to which therapy. I think the use of digital and big data is the next new thing, big thing that we will have in ophthalmology.